CBS 13 News at 10.
This week, we've explored different aspects of Prop 64, which would legalize recreational marijuana in California.
What people are saying is, I voted for it, but I didn't vote for that.
We went to Colorado to see how they've handled legalization for the last 3 years, how they regulate and enforce marijuana, and what impacts weed has on business taxes.
And tonight we dive into public health. CBS 13's Drew Balea tells us if public health is impacted by legal marijuana.
The way marijuana is used has changed over the years. It's no longer just smoked, but eaten, dabbed, licked, and even rubbed on the skin. We went to Colorado and talked with medical professionals to see if use is up and what effect that has. Colorado consistently leads the nation when it comes to marijuana use. According to a state report, adults are using marijuana more often than before legalization. Teen use has stayed about the same.
We certainly haven't seen anything dramatic with regard to poor health outcomes.
Larry Wolk is Colorado's Director of Public Health. Wolk says there are positives with marijuana, but also documented concerns, especially for young people.
We certainly know that there are some negative consequences, certainly for youth, with regard to the developing brain.
Wolk says the drug may reduce thinking, memory, and learning ability.
With teenagers, you can see things like a loss of motivation, a loss of drive.
But is there a widespread public health concern? Andrew Friedman is Colorado's Director of Marijuana Coordination.
We're unable to draw any sort of causation between legalization and an increase in some sort of public health, public safety concern.
According to a federal report, Colorado hospitalizations related to marijuana increased by 3,200 in the years following legalization. But that may be easily explained with inexperienced users.
The majority of those are occurring amongst out-of-staters or people who don't live here in Colorado.
An AMA medical study shows pediatric hospital visits in the state related to marijuana rose from 9 to 47 after legalization. The main cause? Kids accidentally eating edibles, which commonly look like cookies or candy.
We certainly didn't want edible marijuana products to be enticing to kids.
And starting October 1st, a new Colorado law will require more identification on edible products.
It'll be a caution sign with an exclamation point in it, the letters THC.
Potency is another issue. The products are getting stronger.
Very clear evidence that potency is rising. Average potency has risen substantially.
According to state and federal reports, THC, the psychoactive chemical in marijuana, is at an unprecedented level. Marijuana flowers and buds have an average potency of 17%. Concentrates like edibles and oils average 62%.
People are viewing these new products and potencies and intake methods that have never been seen before as safe.
Diane Carlson with Smart Colorado argues the scientific information to back up the safe claims just aren't there. The federal government lists weed as an illegal substance, which limits research and leaves it up to special interest groups to make the case for what's safe and what isn't.
There's a lot of conflicting information out there about the potential effects of marijuana.
Drew Soderberg with California's Legislative Analyst Office says it's difficult to find credible information for voters in this state.
It's really difficult to draw a lot of conclusions from what they've found.
And that's why public health officials in Colorado say they're part of a grand experiment, and the public is the sample.
I would like to see a little bit more restrictive start so that we can understand the science of marijuana and THC a little bit better.
On a social scale, how are commercialization, advertising, and normalization of marijuana manifesting in Colorado? And what can we learn? That's tomorrow, as our in-depth look into Prop 64 continues.
As Drew mentioned, all this week we've been exploring Proposition 64. The series wraps up tomorrow, but if you missed any of our coverage, you can head to our website, cbs13.com, to get